Hello, my name is Jill Berry Bowen, CEO of Northwestern Medical Center, and your host of the NMC Health Beat Show is dedicated to discussing important healthcare topics of interest to our community. Today, I'm very fortunate to have Dennis Boucher with us. He is the Information Systems Operations Manager at Northwestern Medical Center, and we are going to discuss technology. That could take us a while, I think. So good morning and welcome.
Good morning. Thanks for having me.
Yeah, it's great to have you here. So, Dennis, maybe we should know a little bit more about who you are before we get started with our conversation. And what does an Information Operations Manager do?
So, Jill, I spend my days making sure our service desk, well, actually, I should start by saying I've been at NMC for about 13 years now, a little just shy of 13 years, and I've held several different roles, but as I've evolved into this position, I've taken responsibility for our service desk, making sure all of our end users have a point of contact when they're having problems with their equipment or with software. I have a couple of engineers who take care of our network and make sure the phones work and that all the computer systems operate, and a couple of application analysts as well who keep everything running smoothly and hopefully up all the time, as close to that as we can.
So you're probably the one who knows our information systems the best. I mean, all of the aspects where, all of these wires, you go into these data closets and there's wires everywhere. So you keep it all working behind the scenes.
Yeah, with the 13 years experience in the hospital, I've certainly been in all the closets and all the corners that sometimes you still discover one that I haven't been in, but it's definitely not something one person can do. It takes a really strong team. The operations team is just one piece. We have two other groups within the IT structure. Our informatics team, who takes care of end user training primarily and building our systems and doing updates to the systems to kind of improve workflows and efficiencies. And then we have a data management and information group who write reports and manage or look at our data to try to analyze, where we can improve efficiencies in general. So it's a big group, and there's a little over 20 of us now. So
wow, it's changed so much just in the few years that I've been here. It's probably the fastest growing division to support
I would
everything.
Agree. I think so.
Yeah. And you've just been recognized as the most wired hospital. And can you talk about what that award is and how that matters? Why does that matter?
Sure. The Most Wired Award is a recognition of hospitals by the American Hospital Association who use technology to improve our operations, to make sure we're providing exceptional care to our patients through technology primarily. It's really not an information systems award, it's a hospital award. It's recognition that there's a lot of hard work behind the scenes in all departments that keep our electronic medical records and electronic systems in the forefront as we're taking care of patients. So things like medication checking, making sure patients are being given the right medications, requires interaction with our pharmacy, for instance, or our health information management section was really integral to answering the survey that we have to complete to earn this recognition. So we reach into many different departments. I think, by the time the survey's done, I wouldn't be surprised if every manager is contacted by my supervisor, Joel Berry, our CIO, as we fill out the survey. So it is a group effort, but it's a great recognition. It matters because it shows that we're on the right trajectory. The awards used or the baseline that they use in giving the recognition it kind of talks about best practices. It looks at hospitals across the country and what they're doing and where they're improving to the use of technology, and it just shows us that we're on the right track. It helps us with our strategic planning. So.
Yeah, and it builds a community confidence as well that we are on the right track. Absolutely. And we are advancing. It sounds like the criteria keeps you building and progressing.
It does. It changes every year, so it absolutely keeps us looking at what's coming, and I think we do a good job of that in our own right, but it's good to have that framework that they provide, and it's a great honor for us to finally get there. It took a couple of years, so.
Yes, it's nice to set those goals and That's terrific. So congratulations to you and your team. I know it is a hospital award. You need everybody engaged in it, but we also need leadership, and to get us on that track. So thank you for that.
Great.
I know you and Joel have worked very, very hard to guide your team, and your team has really come together. It's really been a wonderful team to see it grow together with you.
It's a great team.
Yeah. So we also have a major construction project going on. And what I remember when we moved the Crest Road over, I think in talking with you, is that there's almost, we look at the pavement and the movement, but there's almost more infrastructure work underneath that road. So when you look at a project this big that we're doing at the hospital, I can only imagine how it impacts your department. We think of you as behind the scenes, but what does this construction project mean to you, and where are we going with information systems with this new project?
Yeah, we certainly have to do our part to be part of the project from the beginning. And when you mentioned Crest Road, we had weekly surprises, new cables that had been buried that weren't marked. That we really didn't know what they went to, and I had to figure those things out before we either cut them or replace them. And that's continuing in this project as we have excavation going on the outside of the facilities, getting ready to put in the walls and that sort of thing. Inevitably, something gets cut or damaged. This, we've had a short outage with our television in our patient rooms a few weeks ago, but we get out there and get that resolved as quick as we can. But moving forward, as the walls go up and we start bringing technologies into the rooms, we're looking hard at workflows with things like patient registration. We're looking really hard at workflows for nursing to make sure that we can be as efficient as we can be to meet patient needs. So we're going to introduce some new technologies in this project. Everything from some kiosk at the front to help with registration if patients desire to do that, similar to what you would do at an airport when you come in to check in yourself. Just to let folks know you're in the building and that you're here for your appointment. It's not, there's still going to be registrars that are available, but it's just going to be another option. We're going to introduce some communication technology for our nurses so that they're not tethered to a desk, that if a patient needs something in their room and they use their call button at the bedside, they can communicate directly with their nurse wherever that nurse might be instead of having to wait for the nurse to come to the room. So we're certainly factoring a lot of technology into the build as well.
So will the nurse wear like a beeper or a phone? Or
she'll have kind of a smartphone.
Smartphone, yeah.
And that smartphone will act as a device for medication verification and doing some of the bedside things that they do. So they're not tethered to a big cart with a laptop. We'll have computers in the rooms, so if they need that resource. But we're trying to get rid of those carts. We're trying to free things up and keep the room spacious and clean and uncluttered, and that's our contribution to the project as well.
That's terrific. So when a nurse actually comes to the computer, do they have to keep signing on and using all of that, or can the computer recognize the nurse so they can pick up wherever they were last? So how are we making it easier for the clinicians at the bedside?
Yeah, that's a great point, because that's one of the bigger projects that we have going. We're actually starting to roll out virtual desktop technology, which it's been around for a little while now, but the timing's right for us at Northwestern. And what that allows us to do is create a session, a computer session for a nurse, for example, on a server. But that server session can follow that nurse wherever they are on any computer in the hospital. So just by simply tapping their ID badge and putting in a PIN number, their session would be presented to them. And then if they move to another patient room, when they leave the first room, that session kind of gets locked. But when they get to the next room, that same information, the same screen, everything they were doing is with them where they move to. So as they go from room to room or room to the nurse station and back, they have a really efficient workflow that speeds things up, and it allows them to focus on the patient. So.
Excellent. That's terrific. That's very, very exciting.
It is, and it's a great thing for support as well. It makes our lives in the IT world a little easier to support, so we can react faster in updates and that sort of thing.
That's excellent. So talk a little bit about, because I'm sure the community would like to know about how we're protecting their information. We've got computers and all this data flowing around. How are we ensuring that their personal data is protected?
Yeah, that's probably probably my number one job. Of all the things I do, patient data, it's a big deal. Everybody sees in the news now all the concerns about data breaches and that sort of thing. So we do things like, we have a process called Defense in Depth. So we look at technology, processes, and people. So we put a lot of technology in place. We have software to watch for viruses and that sort of thing. And we have processes in place where we make sure we do our software patches every month, and that all of our systems are up to date with the latest and greatest software that lends itself to keeping us from the risk of some of this nasty software that gets released.
Yes.
And then we deal with people, and with people, it's really about education. So it's helping folks understand what they should and shouldn't do when they get that email that just doesn't look quite right. And we do a lot of education around that, whether it be email or in group settings. We're actually going department to department right now and kind of really targeting that department and what they might see that could cause a problem. So we're trying to make people our best defense and not allow the bad software in, but we certainly have a lot of technology in the backside that we deploy and update, and we're always looking at the latest and greatest to keep us out of trouble.
Because now patients can go in on our patient portal and see their lab results, and so they can be more in tune and up to date on their information. So is that portal, is that protected? Would you encourage people
Absolutely.
to use that portal?
Absolutely. The communications with the portal, is, from our servers, that information is provided to the patient when they log in. So everybody's given a secure login. The websites themselves are secure, so the information as it's transferred is done in a secure fashion. But it's absolutely safe, and it's actually a great resource for patients, to be engaged in their care by seeing those results and knowing what what the function of the portal can do for them is make them more aware of their own lab results, and when they have x-ray results and those sort of things, or even updating their medication list and keeping the hospital informed about changes in their health so that they get the best care they can. But using the portal is really safe. It's the same thing as anywhere else. If you have a strong password and do all the things you would do when you're on your personal banking site, you'd be perfectly fine.
Okay, great to hear that it's safe and secure.
Right.
So we do hear about ransomware, and in the public, and people are really worried about that. So I don't mean to be totally focused on that in our conversation, but just to put folks' mind at ease on how do we address the threat of that? Yeah,
it's a real threat for sure. It's one of the things that certainly keeps me awake at night a little bit, and it really goes back to the education, because ransomware, what it is software that gets launched on the computer when somebody clicks a link in an email or opens an attachment that has this bad software embedded in it. And once that happens, it can lock the computer and all the data that's on it, and potentially even the network, if we didn't do the things that we're doing to protect the network. And the only way to get that released is to pay a ransom. And the folks that are doing this stuff, the one thing they're doing right is they're unlocking the computer after you pay the ransom, because they want that to be the trend, right? And that will pay the ransom. But we do things that we make sure we have really good backups, and we have plans in place and processes to hopefully mitigate any kind of risk like that in the hospital. And for people at home, it really is, don't open that email if you don't know where it came from. If you don't know the sender, or if it looks somewhat suspicious, delete it. If it's important, somebody will reach back out to you. And that's the best advice I can give, is not to click on those links or open anything that you're not aware of, because it can happen at home as well. And then have your antivirus up to date as well.
Yes, excellent. That's excellent advice. Don't open any message that is not familiar to you or looks odd.
I get your 1 a.m. Should I open this one?
Well, our time is really coming to a close pretty quickly. So when you look at the future of technology at NMC, can you just give us a little snippet of what you anticipate?
Yeah, I think the direction is going to be a little more about patients being able to enjoy some sort of care at home without having to come to the hospital or to their private physician's office. So telemedicine is really kind of taking off. Use of things like an iPad and having those one-on-one sessions with your provider for follow-ups and that sort of thing too. avoid having to come back to the hospital for just that 15-minute check-in. And there's other technology as well, so tying into your Fitbit or looking at home scales and those sort of things, and having that
Wow.
data automatically uploading to your medical records so that your provider can help keep track of how you're progressing in your recovery and that sort of thing. So I think the next couple of years, that's where the focus is going to be.
Excellent. Well, I could keep talking to you for a very long time.
Likewise.
You're full of information, so thank you very much for being on this
It's
show.
my pleasure. Thanks, Jill.
Jill Berry Bowen, CEO of Northwestern Medical Center, thank you for joining us to hear more about technology and to congratulate Northwestern Medical Center for being the most wired. We're advanced in our technology, and that's terrific. But we can't stop growing and learning as an organization. So thanks for joining us.